So I'll be talking about hand hygiene or hand washing. Like I said, hand hygiene is keeping the hand clean. It's actually a way of maintaining cleanliness of the hands in order to avoid transfer of microorganisms and dirt, soils into the mouth. And of course, you know that these microorganisms, they are responsible for infectious diarrhea, cholera, even acute respiratory tract infections, especially when you use your hand to touch your nose, your mouth. Okay, so that is what hand hygiene is all about. Simply keeping the hand clean. Okay, so that we can a healthy live a lead a healthy life. So how do you go about this? It's actually a habit we have to inculcate in our daily activities. There are different times in the day at which time it is very important to maintain a good hand hygiene. After using the toilet or the bathroom, we're supposed to wash our hands. Before preparing food, we're supposed to wash our hands. When washing fruits, vegetables, raw meat, fish, it is good to wash our hands before then. When feeding a child, it is good to wash your hands. When you want to feed yourself too, you also wash your hands. Some people may say, they will use spoon. Remember, you also touch the spoon that you use to eat. Okay? After washing a child's bum, after he has pooed, you have to wash your hand. So it's a habit you need to inculcate on daily basis. Practice hand washing hygiene. Practice it. Whenever you come back from work, remember you must have shook a lot of people on the road or at your workplace. Remember to wash your hand before leaving the office. Even if you do not wash your hand, when you come back home, the first thing you should do is to wash your hand. So how do you wash your hand? You wash your hand under a running water. If you don't have a running tap, okay, you can have someone pour water on your hand with a bowl so that you can wash your hand. And you can use liquid soap. Liquid soap is should be better, okay, because it's moist. To help you to wash your hand well. Though if you don't have liquid soap, you can use bar soap. It doesn't matter, whichever one. The most important thing is that there should be a soap, either liquid or bar soap. Okay, so you wash your hand, and you wash your hand, you wash the nails area, you wash your palm, you wash in between the fingers, the finger webs, you wash it, you wash your wrist. Okay, those are areas that germs can easily stick to, especially in between the fingers. Okay, you wash it very well, then you rinse under the running water, or have somebody pour water on your hands as you wash. Okay, so that is how to practice hand hygiene. Remember, I said hand hygiene will prevent a lot of infectious diseases like infectious diarrhea. Okay, infectious diarrhea can prevent cholera, can prevent acute respiratory infection. Like I said, when you use your hand your hand that has been infected with microorganisms and touch your nose or your mouth. Okay, so that is it. So you practice. Just always have it at the back of your mind that you always wash your hand before touching anything, before putting anything into your mouth. Okay, and also it's very important to, even in breastfeeding mothers, you wash your hand very well before you breastfeed your baby. Wash your hand very well before you wash the cup and spoon you use to feed your baby. Okay, so that is it. It's very important. Thank you very much for watching. Have a nice day.